Hi, I'm Julie Daniels and I've been involved in stem cell research since 2002. It was a really exciting time for us to become involved because we set up the first facility in the UK to start growing cells for patients. Our goal was to restore vision in the cornea following injury or disease, and I became particularly interested in a rare heritable condition called aniridia. And I've gotten to know a number of parents with children who suffer from this disease for which there's currently no effective treatment, so they've really become our inspiration. The research of the Cells for Sight programme is aimed at understanding the normal stem cell environment and how we can use that information in the development of new therapies. One of the approaches is artificial tissue, which is populated with stem cells, and we call that raft. So our Cells for Sight research programme involves making artificial tissue. So for that we have stem cells populated inside a collagen gel, and we're hoping that this will be a good approach to help these patients with aniridia. So we're now preparing to start a clinical trial at Moorfields Eye Hospital with raft for patients with aniridia, and this is a really pivotal moment for the team. It would be so amazing to be able to help these patients and restore their vision.